first reached out to me, and I'm super excited to share it with all of you. So as Randy said, I wear two hats. I am a coach, a health and wellness coach, but I am also a consultant. And today, my goal with all of you is that you can walk away with what you need to have the business case to talk about health and wellness coaching, health and wellness, and even a little bit of consulting to move you closer to Vision 2030. No need to take any notes. I'm giving you all the slide deck and lots of other goodie things. Randy, I love a good party, and I love a good party that ends with a goodie bag, like when we're children. So I like to send everybody away with a goodie bag. And also for today, Randy and I really enjoy working together, and he's going to be manning the chat. I want this session to be as interactive as possible. So if you've just got questions that pop up, Randy's going to be watching the chat. We will have plenty of time at the end for Q&A, but by all means, ask during. No reason to wait until the end. And Randy, just interrupt. Open up your mic and we'll stop to answer questions. I just think it's more lively and interesting for everybody if we can do that. So please feel free to use the chat for that purpose. I've turned my chat off so I can focus on my slide deck. You're all getting the slide deck, so sit back and relax and let's get ready. What are we going to do in the next hour and a half? First of all, we're going to have a little look at what I've learned about Vision 2030, the kingdom's aim and goals for the healthcare sector transformation. And I really want to show you how health and wellness coaching can be an integral part of that. I'm going to show you something about the global health context, and you'll situate Saudi in this context as well. I'm going to define health and wellness coaching. Many people don't know what it is, and you'll see why in a few minutes. The state of the profession. When I say HWC, or HWC is on a slide, that's short for health and wellness coaching. We're going to look at the settings for delivery. Where can we deliver health and wellness coaching? Global trends, and then we're going to end with what now? What can we do going forward to really support the kingdom's vision? So if everybody's on board, let's begin. I am part of the Global Wellness Institute Wellness Coaching Initiative. And a lot of the data I'm going to be giving you today comes from a white paper that we published on Times Square, believe it or not, in New York City, Randy, in February of this year. I will be providing you this white paper, so you will have all the reading that you want. But just so that you know where the data comes from, the white paper. And the white paper is actually all about health and wellness coaching. The second thing I've based a lot of my work on is something most of you are probably quite familiar with now. Being launched 2022, Vision 2030. Now, I've read all of the materials around Vision 2030 and what the kingdom wants to do with healthcare. But I've really narrowed all of these objectives in this circle, which comes from your data, your reports, into two major objectives: prevent disease and promote public health. So those are the two things I'd like us all to keep in mind as we move forward. Can health and wellness coaching help prevent disease and promote public health? Let's start by looking at the global health context. So preventable chronic disease is associated with unhealthy behaviors, has reached epidemic proportions all over the world. Chronic disease can be prevented through diet, lifestyle, and environment. Now, some of you might be wondering what chronic disease is. Let me just share that with you. Chronic disease is something that cannot be transmitted from person to person. We're looking at diabetes. We're looking at heart disease. We're looking even at cancer. So chronic disease, preventable, has reached epidemic proportions and can be prevented. COVID-19, which, as you know, is a virus, is not a chronic disease, but it spotlighted the importance of health and immunity to everybody in the world. Given the new era of personalized care, individuals have started to take an active role in improving their own health and well-being. People are starting to take care of themselves. And as you know, with all the apps and all of everything we have on internet, we can do that today easier than we used to be able to. We've got more information. Many individuals struggle to master the kind of behavioral change that allows them to change lifestyle and health-related behaviors. Finally, health and wellness coaches can help people proactively take charge of their health and well-being. This is where we're at today. This is an image not only of Saudi, this is a global context. And interesting, when I pulled up the core challenge of Vision 2030, we find that chronic disease, preventative, and diabetes are part of it. So we're already beginning to link specific Saudi Arabia issues and the core challenges of Vision 2030 with what we do best. These are just to show you some of the outcomes of coaching interventions for specific diseases. You can see, and specifically diabetes, you can see the percentage of improvement after a coaching intervention with various chronic diseases. To the left, cancer, hypertension, heart disease, diabetes, weight loss, quality of life, and cholesterol management. And this is science from our white paper. There's also outcomes of health and wellness coaching for prevention. What I found interesting about this slide, you've got psychological outcomes, nutrition behavior, and exercise. But isn't that interesting that health and wellness coaching even helps psychological outcomes, which, as you all know, have become more and more prevalent through COVID-19. So, what is health and wellness coaching? Well, many, if not all of you on the call are coaches, so you know what coaching is all about. And what health and wellness coaching does, it draws from multiple theories, some of which you are aware of. I'm sure, Randy, you know some of these from your coaching. Health and wellness coaching, we're looking at neuroscience. We're looking at motivational interviewing. I'm sure you do that as well, Randy. Self-determination theory, trans-theoretical model of change. I bet you're also familiar with that one, Randy. Positive psychology, that came up in our chat today, didn't it, Randy?
Yes, it did.
Cognitive behavioral principles, social cognition, emotional intelligence, and mindfulness. All of these combine together to create health and wellness coaching. So I hope, and I think you're probably now starting to think in your coaching how this compares and where there might be some differences. Let's go a little bit deeper on this one. Health and wellness coaching is a client-led process with self-determined goals, raising self-awareness, giving insights. This is a place where we differ a little bit from other types of coaching, because you can imagine that health insights like ideal weight, ideal blood sugar, that's science, and we need to share that science with our clients. We build on personal strengths, self-management strategies, lasting behavior change, unconditional positive regard, client empowerment. That's one of the biggest ones in health and wellness coaching, because I will take a simple example, Randy. Diet. Diet is the way we eat, and nutrition. And very often people aim to lose weight by going on a diet. I personally say diet is a 4-letter word that starts with die. We should not diet. Diet does not empower the client. Diet constricts people to rules to follow, and it never works. What we have found with health and wellness coaching is when we empower the client or the patient that they actually stick to their own diet or behavior. It's just an interesting little anecdote. Self-discovery and overall well-being. This is all a part of health and wellness coaching. The definition, and this is the definition that we have come up with at the Global Wellness Institute. A patient-centered approach wherein patients at least partially determine their goals. At last, they use self-discovery or active learning together with content education to work toward their goals and self-monitor behavior to increase accountability, all within the content of an interpersonal relationship with a coach. So that's what a health and wellness coach is. And today, the state of the health and wellness coaching profession, there are no credentialed or regulated global bodies like ICF for health and wellness coaches. But there are 3 industry leading bodies. The National Board of Health and Wellness Coaches. I am a National Board of Health and Wellness Coaches accredited health coach myself. There is the UK Health Coach Association in the UK and Health Coaches Australia. These are 3 representative bodies that have created credentials. And I think it's really interesting to look at this map because you can see in the dark pink, you have people that are national board registered and accredited. And the light pink, those are NBHWC, the US accreditation. That is actually the US Medical Examiners Board. It is the highest level of accreditation for a health coach. And the one that's a little bit global, you can see by the pink. And I looked in UAE, there are a number of coaches that are NBCHWC accredited. Then you've got the UK, up in the UK, that little blue bit, and Australia, pretty much in Australia. So I think what we see here, this is to speak for our American nationality, Randy, is that the American accreditation, NBCHWC, is the most globally accepted today. Super interesting. So the credentialing is led by US and UK. As we said, board certification, exams approved by the National Board of Medical Examiners like doctors and nurses. Research is underway by the American Medical Association to finally get insurance reimbursement for health and wellness coaches. So we are actually on our way to getting reimbursed by insurance. In the UK, they basically are setting up standards and scope of practice, and they work on 4 pillars: education, coaching, health and wellness, and professional practice. So just to kind of give you an idea of where health and wellness coaches are coming from. In Europe and Asia, it is unregulated. In Europe, where I live, like myself, I sought NBHWC certification, and many do. It has not been integrated into clinical practice at all here in Europe. And there's a little bit of health and wellness coaching in the workplace. We're going to talk about that in a few minutes. I think that will be interesting. Asia Pacific, same thing. Some seek NBHWC certification, and they have a few other credentials. The Singaporean government is quite ahead on access to health and wellness coaches. So it's really interesting to see what's happening in the world with health and wellness coaches. I just want to stop right there for a second, Randy. Are there any questions up to this point about what's a health and wellness coach, credentialing, and what's going on like in that area up until that point? Any conversations popping up there?
Yeah, guys, put your questions in the chat and we can read them if you have any. Or we can take some hands. I see Lena Arias. Maybe you can unmute yourself.
Please do.
I can ask your question.
Hi, everyone. I'd like to ask a question. According to what you just said, إنه only يعني the medical professionals, they are gonna be certified and they will gonna be مثلا accredited as a wellness and health and
No.
wellness coaches. No.
No, I'm sorry. You certainly misunderstood. No, I am not a medical professional. What's
Okay.
interesting, and I think I understand what you misunderstood there, Lena. Thank you very much for that very intelligent question.
Thank you.
The National Board of Health, I'm just going to go back a slide. I'll show you back here. Okay, so back up here, the US National Board of Health and Wellness Coaches. Okay, and we'll look at the map again. It's the pink, light pink and dark pink. The National Board of Health and Wellness Coaches is part of the Medical Examining Board of the United States. So what they do is the Medical Examining Board, they examine doctors, they examine nurses, they examine X-ray technicians, and they examine health coaches. But you go in there as a health coach and you take a health coach exam. You don't take a doctor exam, you don't take a nurse exam. You can be a nurse or doctor, and I know a few that have done it. I know one doctor at Harvard Medical School that sat for that exam because he just really wanted the coaching skills. And we're going to talk about that a little bit later on with Hélène, the coaching skills. So there are means of doing that, but it's not for medical. As a rule, it is not for medical professionals.
Ellen, I want to piggyback on that with this question by Hannah Abdelaziz. She says, is HWC for health practitioners only? And you would say?
So no, it is not at all. It can be. And I could actually send you all NBC HWC, that's the National Board of Health and Wellness Coaching. National Board, I'm trying to remember what the C is for. I have to remember. National Board of Health and Wellness Coaching. NBC. It used to be the National Board Consortium, and they changed the name, but the logo is still the same. So it's not for health professionals, but when you sit for the exam, there are questions on health and wellness. Otherwise, it wouldn't be valid. So you have to be a health coach going in there. The great majority are health coaches, and they've done health coach training. We can talk about that training a little bit later. Is that clear? For both Lena and the person that asked in the chat?
It looks like it. Are there any other questions before we move on? Yeah, it's clear.
Cool.
Great. Okay, go ahead.
Wonderful. All right, so we're accredited. Now we're going to looking at where we work. Where are health and wellness coaches working? Health and wellness coaches are working in private practice. So very often you've got doctors that they don't work on behavioral change. A doctor works on prescribing medication and telling the patient what they have and what they have to do. But then they will work with a health coach, who the health coach can actually help them move forward with that. We've also got a lot of health coaches like myself that work individually. That's the private practice. It's the clinical practice working with the doctor. We've got a lot of health, and my specialty is workplace. I work for corporations that help their employees be healthier, workplace wellness. You also have health insurance plans. There are, especially in the US, a number of insurance plans that provide health and wellness coaches to either individual insurance takers or to companies that provide insurance. And that pretty much is only happening in the United States, that actual health insurance plans. We're seeing more and more health and wellness coaches in schools and universities. I spoke with someone again in the United States last week. They have health coaches in the universities right now that are helping the students deal with their mental wellness. So again, we saw that we can help with psychological earlier on in our data. We can help with positive regard. So we've got a lot of health coaches working in the university setting right now as well. We've also got more and more in wellness and spa retreats. Again, you go and you do a detox, you do a retreat, and then you go home and everything falls apart. Well, if you have a coach to meet with once a month to keep up those habits, to develop those habits and to grow, it stays. And that's our goal, behavior change. Finally, you're also finding health and wellness coaches in fitness centers. And sometimes in the fitness centers, Maybe they're also a gym coach on the side, a fitness coach. Maybe they're a nutritionist. Health coaches come in many flavors, many flavors. My specialty is workplace wellness. And you'll see that that is actually part of the trend and part of the future settings of health and wellness coaching. The global trends today are about integrative and preventative care. And so you can already see, remember at the beginning when we looked at the Saudi Vision 2030, the vision was preventative care. Well, you're on the same track that we provide with health and wellness coaching. What's interesting here as well is that the trends today worldwide are more and more government support. We saw the US were lining up for insurance coverage. That's government. We saw in Singapore is providing health and wellness coaches. And now Saudi Arabia is bringing this into the Vision 2030. This is the trend. You're absolutely on trend, which is part of the reason I congratulated the initiative when we began this call. Workplace well-being, well, we all work. We're all in the workplace. We are more productive, we are more performing, we sleep better, we feel better, we burn out less if we feel good. So that is really my domain of expertise. And this shift to a hybrid model, the fact that we can work online today has made scaling the profession through technology and group coaching possible. We can run sessions for 100 people at a time. I ran sessions through COVID for Qatar airport employees. I had 200 employees on the call. You can imagine they were locked down. And then there was Ramadan. I mean, it was really hard on their health. And we worked them through it by group sessions. Fantastic. Only thanks to tech. So what's happening with government support? Again, Vision 2030 is one of these initiatives. We're seeing more and more community-based programs all over the world. We're starting to see reimbursed access to health and wellness coaches. We just spoke about that. COVID-19 has boosted this. People are more aware because they need this well-being today. And there's this great focus on prevention. We've seen it in the UK, Singapore, Australia, and now in the Kingdom's vision. So really, the next big chunk of what I really wanted to communicate and share with you all is about workplace wellness. So let's do a little bit of a dive on workplace wellness and open up this conversation. So what is this all about? And I say workplace, I don't say corporate. A workplace is any place where people work. It could be an office, it could be a factory, it could be an airport, it could be a hospital. So we're thinking of this context because this is where we can make the most impact. For Vision 2030 healthcare, this is where we can really have the most impact. These are the latest statistics on employee well-being. And again, I'm providing you with all of this so you can share it with your employer when you go back. 78% of corporations and corporate leaders today say employee well-being is crucial to the bottom line, crucial. 63% of the companies with well-being programs report better financial sustainability and growth. 53% report that it helps attract and retain top talent. Young people are requiring their employers today to provide workplace wellness. 90% of employees appreciate leaders supporting health and well-being, more than 90% actually. 70% of employees would like to participate in well-being programs, and 30% lower levels of absenteeism when we put workplace well-being in place.
Ellen, sorry to interrupt.
Please do.
I got a question. I think this would be helpful for you to answer. From Karen, are these stats included in your 2002 white paper? or sorry, 2022 white paper. Okay, great.
These statistics on employee well-being are not, but I've put the links to all of these in your goodie bag. So each one of these statistics you can find in your goodie bag. Up until this slide, everything you had is in the white paper. And from here on, I've given you all of the references and links to these. Very good question. Thanks for asking. You will have this. I want you guys to be able to walk into your HR department tomorrow and say, guys, we've got to do this. We've got to connect. We've got to start this. And you can do it in a group. So we'll get this conversation going. Anything else interesting coming up there at this point, Randy?
In terms of health
Questions?
and wellness being, questions. Let's see. Where's the link to this is asked? I think you'll provide that towards the end,
I
right?
will be providing all the links. Yep, all the links.
Yeah, so towards the end, if you guys stay, you'll get all the links and everything that she's referring to. You're going to leave equipped, so don't worry.
And you'll get all the slides, and it's all hyperlinked into the slides.
Okay.
Return on investment when we invest in workplace well-being is $5 to every $1 spent. Phenomenal statistics, phenomenal. And COVID-19 has heightened awareness. So it really is the time to do this. Employee well-being trends. So what's hip? Well, you know, diversity, equity, and inclusion, inclusiveness, belonging, whether this be the cultural discussion, whether this be the women-men discussion, the gender discussion, belonging and inclusiveness are critical and crucial to well-being in the workplace. We're also looking at a multi-generation workplace. I work a lot, and I published my first book last year with the 50+ generation and integrating them into the workplace because we don't have enough young people following them to take their places as they retire. So we're working on having these 5 generations work together, very young and the very oldest, and even increasing that retirement age, especially since longevity is getting longer and longer. That's what my book is about. We have a multicultural workplace, and even places that didn't think they would be multicultural, now that we are on Zoom, now that we have technology, we have to be multicultural. We have to be. Employees expect their employers' values to align with their own. Many of you have heard of the Great Resignation. Well, reason that that's happening is people aren't connecting with their employers' values anymore. They leave. We want to keep them. We want to align those values. And believe it or not, that's also a part of health and wellness coaching. It's aligning with our values. This shift toward prevention and lifestyle as medicine, this is all coming together. You're seeing the link with the Vision 2030. You're seeing the link with what we do as work. And this is what we're looking at in the workplace. We talk about resilience, physical and mental. And all of this is the scope for our health and wellness coach. However, most employers fall short of offering a comprehensive well-being program, including health and wellness coaching. So it's a call to action. It's something we can do. This is an excellent peer review study, and this is the conclusion of the study. The integration of health and wellness coaching in the workplace interventions has increased over the past years. However, the tasks and the qualifications of the coaches have not been clearly defined. See why we wrote the white paper? This is exactly why we wrote the white paper, because there's this lack of understanding and knowledge of health coaching. And I'm looking forward to a lively conversation afterward as we go into the Q&A about this. A health and wellness coach helps employees identify their goals and needs, explore their personal motivations, spot obstacles and challenges, discover capabilities and resources, formulate clear and attainable plans by providing ongoing education and accountability. There are different ways of delivering health and wellness coaching. We can deliver it as an independent coach, as a coach within a company or within a workplace. We could train health coaches like in a hospital or in a company, or we can work with external providers that actually have a pool of health coaches that are credentialed. In person, phone, online, with tech support, or combined, one-on-one or in groups. So there are multiple ways of delivering health and wellness coaching. And again, your business case for diversity, equity, and inclusion with a diverse group of employees with lots of generations and backgrounds and health statuses, employees feel supported because they have a personalized attention beyond physical well-being, integrated everything that affects lifestyle. And I put the PS down here because there's been a lot of isolation and loneliness during the COVID time. And this also helps resolve that issue. So again, a few more just resume of our business case. Health and wellness coaches meet employees where they are. Physical, mental, and emotional well-being, burnout, stress, resilience, and productivity, absenteeism, presenteeism, retention, attraction, adherence, self-care, inclusion, and belonging. It's really resumes everything that we can provide in the workplace. And your business case, all of these are hyperlinked. Better health outcomes, more satisfaction, improvements in burnout and resilience, just as effective remotely as face-to-face and in numerous settings. So there's strong evidence, and all of this is hyperlinked for you so you can find this business case. I realize that there's not a lot of health and wellness coaching going on right now in Saudi Arabia, and anything we can do to nudge this forward, create the ripple effect, and share this knowledge can only be beneficial to you and to us. So, what now? Before I go into the what now, Randy, are there any questions coming up in the chat?
There was some discussion here. There was a little bit of maybe some clarity needed on what did you mean by let me look at it, dollar, the return on investment 5 to 1. Is that the US dollar, or was that in the UK or the Australia? Where was that?
It's the same, and that's why I didn't put a dollar figure there. The return on investment, you are going to get 5 times your investment that you put into it. So if you put in whatever currency, you put in 1, the return is 5, because you're reducing your absenteeism, you're increasing your presenteeism, you're increasing your productivity. So those calculations have been done. And that calculation actually comes from Harvard Business School on numerous health and well-being programs that have been going on. And it's kind of a standard ROI that we look at when we invest in well-being.
Yeah, and something I just want to reiterate too is that, yeah, what you're saying is true, that health and wellness coaching isn't being done in Saudi Arabia, and it's up to us to kind of take this learning and to take the advantages that could be had and go to our respective organizations and to advocate like, hey, this is something that can benefit our organization, our staff, and our clients as a whole. And so really good resources and really good science and numbers that back the claims.
Exactly. So
are there any other questions? Sorry, are there any other questions, guys? There's one question by Dania.
Dania, open up your mic.
Yes. Hello.
Hi, Dania.
Hi, how are you? I have a question. Now, ideally, when starting coaching in the for health and wellness in the corporates, do you usually go for culture assessment?
Yes, it's a very good question. Thank you, Dania. When I work as a consultant in workplace wellness, the very first thing we do is an assessment, and we assess what's being done. We assess what would be the goals, and it's based on a standard checklist that I've actually developed over the years with, say, 150 items, and we check, do we do it? We don't do it. Would we like to do it? Is it a priority? We do that, and then what we like to do is we like to go down into the organization and interview individuals for that cultural assessment. In other words, what are people feeling? How do they feel cared for? That kind of thing. So yes, it's definitely the best place to start. And then from there, clearly you can strategize and create a roadmap. And every company will have a different roadmap and a different team and a different goal. Clearly, priorities. Very good question. And I might add to that as well something, Sadia, is that it is ideal to start at the top of the organization when we do that assessment, because we want that buy-in to happen there. The most successful health and wellness coaching mandate I ever did, we assessed at the top and we individually coached the executive leadership team before, individually, one by one. They each had 6 weeks individual coaching with me. And once they could walk the talk, we then rolled it out below in group sessions for departments, for leaders, etc. And we did that ripple effect from the top down. If the employees cannot emulate, and that's such a part of culture, if they cannot emulate their leaders, it will not stick. I'm sure that resonates with more than one person on the call.
Yes, yeah, we're getting some responses. Yes, that is resonating. That's a really good point to highlight.
Let me go through the what now, and then we can really open up this conversation, because I really think that's the most interesting thing, is to have this conversation. Let's see what we can do with this information we've got today. And again, you're all walking away with the white paper, with the slide deck, and I'll show you what else is in your goodie bag. But let's have this conversation. And there may even be other things that will come up for the goodie bag during our conversation. So if we conclude on what we've sort of seen today in terms of information, the current health climate and global pandemic has brought health and wellness coaching to the forefront. Global trends are systemically integrating health and wellness coaching into many delivery models. It's happening all over the world. A hybrid coaching model supported by tech, complementing face-to-face, is scaling the profession. We are now able to really do large-scale health and wellness coaching. Understanding the profession more, coupled with the evidence-based research, will help future development. And it's completely aligned with the kingdom's vision. And if we go back to that vision, this is where we started. We're coming full circle. Our big goals were prevent disease and promote public health. With those two in mind, prevent disease. How can we support the kingdom to reach Vision 2030? You can upskill. I actually train health and wellness coaches in a workplace program so they can go into the workplace and deliver this program. I have a training program for workplace wellness designed specifically for coaches. I have a next uptake in June. You can get information about that or reach out to me. If you're interested yourself as a coach, or you know a coach that might be interested in workplace well-being coaching, there's also a quiz on my website that you can go and do and see if it's right for you. You can also upskill and do a health coach training program. Give me a call, reach out for a 20-minute session, send me an email, and we can talk. I can talk you through programs that would actually bring you toward accreditation. I do not teach a whole program. I teach workplace wellness, just for your information. That's if you want to, in the prevent side, if you want to prevent disease. If you want to work on the side of promoting public health, Hélène Thériault is on the call today. Ellen is a phenomenal coach, and you can upskill with her. We're going to open her up for the chat as well, so you can ask some questions. What Ellen does is she teaches a coach approach. Her trademark is dive into a coach approach. This is phenomenal for healthcare workers. Ellen is a healthcare worker. She is an occupational therapist. She teaches occupational therapists to use a coach approach. Phenomenal trainer. You can reach out to her, but we're going to open up for the chat so we can chat with her. And there's yet another way of promoting public health. It's once people are actually ill. Once people are ill, if they're trying to deal with adherence to medication, changing their behavior to deal with diabetes because they're ill, because they have issues, that would be medical coaching. And my co-leader, Shri Benarzi, teaches medical coaching. So the difference between health and wellness coaching is preventative. Medical coaching picks up where that leaves off. And we work not only with patients, we work with clients, because 90% of the people are not patients. We are just having problems with chronic illness and overweight and diabetes and sleep, etc. So lots of reach out, lots of goodies. Tomorrow, our community of practice, a little bit earlier than this session, is offering a free for ICF members, a session focused on workplace well-being with 3 case studies. That client I talked to you all about earlier is actually coming on the call, the human resource director. That's a 1.5-hour session tomorrow night on health and wellness coaching in the workplace, specifically a deep dive. And on September 8th, we're running a session on health and wellness coaching in the healthcare setting that Ellen will be doing, who you're going to meet in just a second. You are welcome to join the health and wellness community to practice anytime, free of charge, the LinkedIn group and the coaching community. That way you can partake in sessions like this evening's that really open up the world of health and wellness coaching. For those of you who need a business case, I'm also providing you with an article here that I wrote, Why Health Coaching Should Be a Part of Every Workplace Wellbeing Strategy. Lots of data and statistics in there. Another article about coaching in times of crisis, the white paper I told you about, and the slide deck. So there we are with the party has just begun. Now I would love to open up the lines to lots of questions. Ellen, can we welcome you into the room? Can you open up your camera?
Absolutely.
Hey.
Hello, everyone.
Welcome, welcome. Ellen is coming to us from British Columbia, Canada.
Mm-hmm.
Ellen, would you like to say a little word about Dive into a Coach approach? Because I really skimmed the surface. I skimmed the surface.
Perfect.
Dive into a Coach approach. I skimmed the surface. Tell us more.
Perfect segue to dive in. Yeah, so the journey with creating the diving into a coach has been the model. It really started in a very authentic way and really meeting the needs that I was seeing in Canada. I was really noticing that healthcare professionals, including myself, we are seeing that burnout door, many of us, and many of us are either changing profession, and a lot of companies are struggling to retain healthcare professionals. And it's not just occupational therapy, which was my background and continues to be 20 years into the profession. But when I discovered the coach approach 14 years in my practice, I started to use that approach in my practice. So I was very much using my occupational therapy hat, but I embedded the principles. And from day one of that first training, I still remember, we should have recorded me in that training, but I remember thinking every day was a 3-day training. I kept thinking, why is this not in the healthcare world? Why is this not in my world? Why do I not know this? And at the time, I just finished my Master of Adult Education. I promised my husband I'm done with studying. I'm going to be here to support with the family and the 2 kids. And I was so hooked, and I saw how much it made an impact with my clients, and it made an impact on me significantly, personally and professionally, that I'm now a professional certified coach 6 years later, and develop 22 hours of content that's approved by ICF for continuing education credits, and just really passionate to support healthcare professionals to incorporate the coach approach in their practice without them needing to go through the whole journey that I did. They have lots of training already. Let's provide them with some principles. Let's provide them with some tools so that they can make that impact, Helen, that you've been talking about throughout your presentation.
Now you all see why we brought Ellen in. Thank you so much, Ellen. So useful. So now I expect there are lots of questions. What's coming up for us?
So we have Majda Barhameen. Would you like to ask your question? I'll unmute you right now.
Welcome, Majda. Thank you.
Yeah, go ahead, Majda. You can ask your question.
Did you
Hello?
accidentally? Yes, welcome, Majda.
Hi, this is Dr. Majda Barhameen. I am a PCC accredited coach, and at the same time, I am a consultant internist and kidney disease nephrologist. Recently, I got my master in physician development coaching from the Physician Coaching Institutes in America. I would like to share some information about the vision of 2030. Of course, I worked and I have experiences with the Ministry of Health of Saudi Arabia. Ministry of Health of Saudi Arabia actually, they are working hard towards this vision in terms of prevention and in terms of the disease itself. They are caring about all the levels, from the workplace to the work health worker, to the patients, and to the community. Not only the Ministry of Health, nowadays the non-profit organizations in Saudi Arabia, they are really supporting these visions. They are really supporting these visions because, of course, always all the communities, they should support on it. For me, why I did this, I become physician coach, development coach, because during COVID, we all suffer, we all learn from the COVID. But at the same time, I'm working as a medical director in dialysis center. Just imagine at that time of uncertainty, all my employee and my patients and the family of the patients, they want to escape. They don't know where to go. And at that time, coaching skills, supporting every level. First of all, it supports the employee. I coach them why you want to leave, why you are sitting. What's the percentage that if you don't die from COVID, you will die from other things? And then after that, we coach the family of the patients. Then we go for the patients. So I assure you, and I assure everyone here, coaching skills is very important. It's not necessary that we are getting the degree from any place. It's like our guest here, I think, Alan. You have to know coaching skills, especially if you are working in a healthcare. Coaching skills is very important, and it doesn't need from you to go through, long journey. So I think as a coach, our responsibilities is to give it away. It's our let's say charity gift that we teach everyone the coaching skills. It's like coaching, like everyday skills. For examples now, I do have the dietitians, social worker, pharmacists, physicians, all of them. I put for them a program for coaching skills, because what we used to do in healthcare, that we just tell the patient, do this, do this, do this, do this. We never encourage him or motivate him to maximize his potentials. Believe me, we learn from the patients. They know their disease, especially the chronic disease. They know. They teach us more than we teach them. So yeah, it is a very important thing that in a healthcare setting, let's start by the worker. Then if the worker, they are really mentally health and they know how to tackle themselves first, they will tackle the patients and we can prevent all the disease. Thank you very much.
Oh, what an incredible testimonial. Thank you so much, Dr. Majda. We couldn't have said it better. And I think, again, you've got the two sides. You've got this side of prevention. And I remember the first time I spoke with Haitham, that's why I brought Ellen in. I said, we don't need to make 1,000 health coaches, but we need to bring health coaches into the workplace if we've got them. And we need to train healthcare workers to use a coach approach. Beautifully said.
Okay, next up is Dr. Samah Al-Fahmi.
Thank you so much for such an informative and data presented about the coaching. I believe the coaching concept within the healthcare system for both patient and employee is something new. I'm very proud and happy that within our vision, those are very, very rooted within our story and within our future vision. I totally agree with Dr. Majda. I'm as well a physician and a certified coach, as well as a leader working on the transformation project. And I see the challenges within the ground, as well as the optimistic about all the steps. My question is, I don't think that we can do the coaching for a patient and for the employee first and wait till the things be completed. We need a parallel track for a patient as well as for an employee. When we're talking about the healthcare sector, is really complex system. We're taking care about talking about nurses, physician, administrator, non-healthcare providers, and all of us. We need to change the mindset to build the future and to understand the current status. So the coaching for a workplace, it must be a parallel to a coaching for a patient. And I believe that we are doing a coaching without awareness within each team. We're working with the internal medicine, surgical team, emergency team, and we are doing such coaching with the daily work. However, to be aware that we need this as a occupational health need must be within the system. So my question is how we can work parallel with a coaching system for the patient as well as a coaching system for the healthcare worker. And thank you so much.
Ellen, do you want to take that? Do you want me to take that? Why don't you start?
Yeah, I can start, and if there's any add-ons, please, that would be wonderful. I just really appreciate all your amazing hard work that you are doing in the field and your profession. It's so needed, and really appreciate your question as well. And for me, what I've done to support that, because 100%, it's the healthcare practitioners need to use that approach. And for me, what I've done in the training, and it is why I've developed it for there's 3 levels in total, and really to get to that stage so that the healthcare practitioners is not just using it with the patients, but that you build the system, the organization, so that there's coaching champions, the leaders. I've had people in the training that is critical for them to be there as well, which is the supportive administrative team. And so for everyone to understand those coaching principles, because we know, and I think that's why I landed with the tagline for Function First Coaching is that it's changing healthcare from inside out. Because as we know as coaches, it changes us when we apply those coaching principles and when we live and breathe them. I think we would all agree that it changes us from the inside out. And that's what I found has been so neat to experience as people go through the training, and that they start developing the structure in their business. And I would say a bit like what you mentioned, Helen, is that everyone will have a different roadmap based on their culture of their organization and the size of their organization. But I find it's critical, in my opinion, to really map that roadmap so that it lands. It's not just about helping healthcare professionals to teach a coaching, to use the coach approach with their patients, but it's also to embed, how do we embed that coaching culture in the organization? Because that is when the admin team can support, the leadership team can support. When I, as the healthcare professional, am burning out, I have a lot of concerns about COVID, we already talk about different scenarios that can happen. So it's really important that someone can support me so that I can stay in your organization. We want retention, and we want more people to say yes. Because I think as I read the Vision 2030 report, similar issues with Canada as well, is that healthcare professionals are leaving. We are struggling in Canada as well to hold on to our nurses. They are burnt out, and it's just a lovely issue that COVID has added to the plate. And then I'm seeing that in your country as well. And so that retention and being able to attract individuals, because coach approach is leadership skills. It's really changing you from a place of well-being. So
I think it's super well said. I think the only thing that I would remind is the vision is yes, the healthcare, and yes, the patient. But for example, the majority of health and wellness coaches, we don't work with patients. We work to help you all feel better, to you all help be healthier, you all to have less diabetes, you all not to become patients. So I think, and the vision is very clear. Yes, it is very much in the hospitals and in the healthcare, but it's also in the prevention. I just think we want to make sure that we have both of those sides covered, and they can absolutely, Dr. Sama, they can absolutely go in parallel. In fact, they need to go in parallel because many people are not working in healthcare. I'm sure it's not even the majority of the population. So we need to really meet people where they're at. It is super important to meet in the healthcare system, but it's just as important to be in the workplace, to be in the community, to be in the schools, etc., to prevent.
That education. And that reminds me, Helen, as you say that, because I think that's such a big piece of that puzzle, is that prevention education, which can come from the coaches. And I think it's why I suspect you notice that gap as well and you have a program that's in place that trains coaches in the health and wellness space to have the tools to educate others about a lot of those diseases that can be prevented, like diabetes and nutrition. And
exactly, the chronic diseases we spoke about at the very, very beginning.
Yeah.
Excellent. What other questions do any of you have about health and wellness coaching, about workplace wellness, about coaching in healthcare? What else comes up for you, or what can we provide you with to help you bring this message forward?
So before we get into the question, there was a point that was made, a reference to looking up in the chat. Just give me 1 second.
I like Dina's point where she said prevention is absolutely the priority.
Yeah. The Iowa Chronic Care Consortium that was brought up by Miriam. Do you have you heard about it? And how does that relate to the health and wellness?
Do you know it, Hélène?
I haven't heard about it. No, I saw it in the chat too. And then it's on my to-do to look it up. She shared, I don't know if she's available. She doesn't mind to
open up her chat. Yeah.
She shared a little bit in the comments what it was, but maybe she can elaborate a bit more if she's okay with that. Sorry to put you on the spot.
Miriam, would you like to join the conversation? Let me see if I can find you.
Yeah, good evening, everyone.
Good evening, Mariam.
Thank you for this very informative session today. I'm glad that I'm here with everyone. Chronic Care Consortium, I heard about it. It's, I think, Organization USA. They're providing also certified health coach training. So just I ask whether you have more information about their organization or not. Anyway, I really get a lot of information from you. I'm a medical doctor. I'm senior consultant family physician also. I'm also certified coach from ICF as an ACC. Applied for PCC now. And also national, as well, I'm a national lead for improving health of people with multiple chronic condition. Just to share our experience in Qatar, as a national lead for a chronic condition, we already started embedding health coach concept in our governmental organization in the primary healthcare and also in secondary care. So for NHS3, which is soon will be published, we will continue this, and it will be for each health provider, as mentioned here today. So we started with allied health as a pilot, started in with dietitian, with health educator, nurses, but of course, it's very important to be covered as a skills, as mentioned, to not make it, to make it more easier and in a simple way to have the skills of the coaching. It's not to have a long journey. So this is just to share with everyone. Thank you very much.
Thank you. And I am so impressed that we have 3 medical doctors on the call that are also certified coaches. That is phenomenal. It is rare. It is happening more and more, but I am very impressed. Are you, Ellen? Yeah.
I just did a thumbs up because I'm just in awe.
Yeah, same. Like I'm in awe. It is the rare. The other thing that I wanted to say, and Mariam, again, thank you for sharing that. And I would share this with you if you jump on a call with me at one point, if you're interested in doing health coach training. There are a number of very good health coach training programs out there. The only thing I would invite you to do is make sure it's got an ICF stamp on it so that you can subsequently pursue your ICF accreditation. The journey to become a health coach goes anywhere from 1 year to 3 years, depending on which program you choose, how often you want to go to school, if you want it online, etc. But there are many very good programs out there. Mariam, I am not familiar with your program, but how wonderful that you found a program that was focused on chronic disease. The program I began with was focused on nutrition because that was a real interest of mine. So find a program. If you're interested in that, we can brainstorm that together at any time.
Great. So the floor is open. Any more questions, comments, observations that you guys would like to share?
I'm checking out the chat here.
Oh, it looks like Sarah, there'll be a recording that Sarah will be able to access, Randy.
Yes, there will be a recording that will be made available after the session at some point. We do have a raised hand, Dina. Let's see if I can unmute you.
Dina's red iPhone 7 Plus.
Okay. Okay, here you go. There you go.
Thank you. Hi, and thank you very much for this session. I'm really excited. I'm full of endorphins and all that stuff that gets us going. It's a bit late, but I'm happy I joined. So thank you very much, all of you.
You're so welcome.
The reason I started with or I registered for this is because I'm a healthcare provider. I'm a speech language pathologist, but I went into the administrative part of healthcare for the past 15 years. And I was looking into more coaching for employees' well-being and engagement and all of that stuff. So this is where I'm happy to see, that we can do this in parallel with the employees. They will be affecting their families, the patients also.
the therapists treating the patients can apply it also. And I'm part of the 2030 Leaders program. And one of the questions that we were asked is to look at the vision, the 2030 vision with all its aspects and all its divisions, and decide on something that we can contribute. And when I looked at those, one of them is to contribute or to have some people who do not exercise at all or do any kind of exercise, to get them to exercise once a week. So that was one of their goals. And I took it upon me as a 2030 leader to do this. And so, you know,
how's
here
it
you
going?
are as a I'm here searching, and I'm looking forward to getting some coaching training and ICF accredited certification. So I'm very excited and cannot thank you enough for this session.
Well, that's fantastic. And I have to congratulate you on taking the initiative to get people moving. I had some issues with getting people moving last year, Dina, and I'm going to share a secret with you, because people sometimes they fear, you know, movement, physical activity. And one of the very first things I did, and Ellen, you've done the same, and you know, is I have them just stand up at their desk. You see that Ellen and I are both standing up at our desks. That can be the very first physical movement that people do. And they go, that doesn't change. That doesn't change anything. The number one issue in the workplace are musculoskeletal issues of the body.
Correct.
And when you stand and you move your body, first of all, you reduce musculoskeletal issues. And number two, you actually get your step count. I've actually probably gotten 30.
I know.
And it's so simple. And when you tell people, they say, I don't have a stand-up desk. And you say, well, then you take an Amazon box and you put it on top of your desk and you work from there, right, Ellen?
And you got it. Yes, very innovative. Yeah, there's so much we can do. And as you said, it doesn't have to be big. It just, you know, take it step by step and start small. And
that's the coach approach.
Okay, great. So I'm on my way.
Well, welcome. We look forward to working with you in the future as a fellow coach. And I saw that Haitham had a question here in the chat. I just want to go over and see what that was. I think it looked interesting. Which approach will be efficient, having a health and wellness coach within the core medical team, or empowering the core medical team with coaching mindset? And what are your recommendations to move forward? You know, Ellen, I'm going to let you answer that because both are valid and you really work in the healthcare. Go for it.
So the first part, which approach would be efficient, having a health and wellness coach within the core medical team? So that's, Athen, what I was referring to earlier, identifying the coaching champions in the organization. That seems to have worked really well, because as we know, the rest of the organization that will learn the coaching principles and the techniques, and they'll have that mindset and use the techniques. But if we just do the training with the majority and then we leave as trainers, it's not going to be sustained. So that piece of identifying who are our coaching champions that will get additional training to be able and identify really what will work for the organization to maintain what they've learned. So for example, I'll give an example of an organization that what they've decided to do. So this is Rogers, here it's a big phone company in Canada. And so they have coaching training incorporated in the whole organization. It doesn't happen overnight, but what they've decided to do, the coaching champions are certified coaches. And what they do is they've incorporated in the meetings. So every month, each team meets and there's a coaching session happening. And I've heard the CEO describe it, and it just sounds so neat. They're all sitting in a circle. There's a coach and a coachee in the middle, and they're having, and often the coachee, what I loved about his story is the coachee is one of the leaders. And they that opportunity to be very vulnerable as a leader, to share, okay, here's what's on my mind. And so what they do is they do coaching training. informally through every single monthly meeting. So that's one piece. Does that help, Hatham, to answer that first part of your question?
I see a thumb up from Hatham. He does say yes. And I totally love that. And I see the same thing. When we teach people to ask open-ended questions, for example, you just get them more involved, and that can be a part of the cultural build. I totally agree on that. And I'd like to apply this question that was a very good question that was asked about the health coach trained or just training the people. It's the same thing with health and wellness. When we create a wellness program, we create regional champions, because you might get that person out walking or running or eating well, but if they're not constantly reminded, it's not about a one-off. It's about making it part of the culture from the top down and having wellness champions. And we reward them. We reward these champions so that they want to keep doing it. So it becomes not a chore, but it becomes part of the fun.
Yeah. And making it fun. I agree. Like, that's such a key piece.
Hey, Ellen, we got somebody standing up at her desk. She totally forgot her desk goes up and now she's standing. I would love to hear, Diane, how you feel next week. If you stand for the whole week, look, put your phone in your pocket, see how many steps you get and see what changes.
Oh, that would be great data. Yes.
It'd be great data. I will tell you, Ellen, the one thing, I'm going to say this now because I don't know if you've noticed it as well. The one thing that most people have changed when they stand up for a week, all the time pretty much, they sleep better.
100%. Yeah, I've noticed.
How interesting is that? And once you sleep better, you've got more energy to exercise and you eat better. So it's super interesting the way we've got this roll-on effect. I got lots of interestings coming up. It's fascinating. Absolutely fascinating.
Yeah. Yeah. So do let us know if you try our experiment.
Do follow us up, Reem. Do follow us up.
I love it.
So we all want to sleep better. And in fact, the program, the signature program that I train in the workplace, it's 3-tiered. It's called My Stress, My Food, What's the Link? My Body, My Sleep, Time to Wake Up. And the third piece is My Values, My Purpose, Time to Align. And we go through these 3 workshops in that order, and we understand the links, like the link we just learned about. And by linking them all together, we really get the holistic picture, and we prevent. That's our big hope, is to prevent. What kind of questions are coming up? What else interests you, intrigues you? Would you like to know? What else would you like to get out of today's session?
So we have a hand raised by Raed Arimi. Well, why don't you go ahead, Raed?
Raed Arimi, can you speak? We see your hand up. We'd love to hear your voice.
Yes. How are you? Good evening, everybody, and thank you very much for your really interesting meeting. I would like to ask about the impact of the coaching on the career guiding or career development facilitation.
Mm-hmm.
Yes. So, as you know, in the last years, the career development facilitation or guiding in general is being a part of the mental health. But if we would like to provide the service as a coaching, like there is some other rules coming as for example, the career guider or career facilitator should be graduated from psychology college, so he can be providing a coach like services, which is considered more advanced than only facilitation. So is there any concept you would like to give us, or to explain more this issues for us?
Yeah, I'm going to take a stab at this one, Ellen. I work very closely with a career coach, one of the best career coaches in our area. Why do I work with a career coach? We actually co-authored a book together. Because what I noticed, Ryan, is a lot of people would come to me with problems with sleep, with sedentarity, with weight, with preventative health issues. And in fact, the problem was their job. And my colleague, my cohort, my co-author would have people go to her to change their career and work on career transition and look at their life goals in terms of work. And in fact, they were really bad in their skin. They didn't feel good. They weren't sleeping. They were burning out. They were stressed. We noticed that we needed to combine our expertises to offer what our clients need. Now, does this mean that every career executive needs to be a health and wellness coach? No. Does this mean that every health and wellness coach needs to know about careers? No. But you'll notice if we go back to my signature program, 3 pieces: nutrition, activity, and sleep, and purpose, alignment. That's what it's about. It's about aligning with self, mind, body, spirit. And yeah, I think that this has a great place. And I think we're missing out on that holistic view if we don't bring health and wellness and mix it with human resources. Did that make sense to you, Rad, the way I expressed that? Was that clear? He's on mute. I think he's out and about. Ellen, do you have anything to add to that?
Yes.
He's there.
Yes, I'm trying because it was muted. Yes. So yes, okay, it's clear. But yeah, as I understand, in regard to the career in general, I'm talking about the career facilitation or career development facilitation. You don't have a special program dedicated for this part, yes?
No,
So-
I don't. Go ahead, Ellen.
Yeah, I
Yes.
think, and correct me, right, if I understood the question correctly, but I think
Yes.
one layer of the question, Helen, was related to, it sounds like maybe in your country that there, or your organization, I wasn't clear, if that expectation is you need that psychology background or specific kind of career background to be able to use that coach approach. And it's something that is interesting as well in Canada that I'm trying to shift people's perception on. And when I do the training, and I don't know if this helps, Raid, but I talk about using an informal coach approach and a formal coach approach. So all of you on the call being certified coaches would use the formal coach approach if you're sitting down one-on-one and going through the whole process of that coaching dialogue, leading with an action plan. But what I find has been really important in healthcare is to teach people about the informal coach approach, because doctors will have 15 minutes with patients. Chiros here in Canada, 15 minutes. Physiotherapists, same thing. And so they need to be able to use aspects of the coach approach and different tools. That's part of the training, but they're still trained in the formal coach approach. So if they happen to be an occupational therapist like myself or a counselor, I've had counselor takes the course, and they have more time and they can use the whole 4-step framework if they want to. But here in Canada, it's been really interesting, my journey. I was told when I started this whole process, I was told, because I was a certified trainer with another company to be able to use their modeling framework. And I was so frustrated when they told me no, but now I'm grateful because Dive Into a Coach approach exists, because they said no. But they said, Helen, there is no way you can teach someone your introduction course in 1 day. We've designed it to train it in 3 days. And I said, with all as polite as I can be, I'm very Canadian, very polite. And I said, I believe you are incorrect. And internally, I said to myself, I will prove you wrong, because what happens in we have lots of training. I studied 7 years to become an occupational therapist. I knew I did not need to start from the bottom of the barrel in order for me to learn the coach approach. And I felt really passionate about this. And 500 participants later, it's been proven. So just, I don't know if that helps or inspires, Rahid, but we have seen that occupational therapists, speech therapists, kinesiologists that have not the level of training that we get as occupational therapists that live in the coaching world. We've seen doctors, physiotherapists. So yeah, I shared that story because I hope I feel the journey and I think I've been where you are with your journey.
Very well put. Very well put. There's another question in the chat. I'm just going to perhaps quickly answer because I think it's also an interesting one. Somebody asked about what are other daily habits that we have. And I have two other ones that I will just share with people in the workplace besides standing up. One of them is taking a break for about 10 minutes every hour to actually leave my workplace. And if I can go outside and get oxygen, I'll walk around, but mostly to breathe. To do something else, to get my eyes elsewhere. It's very important for your tech life balance to not have screen time and do something else to de-stress. So for me, it's moving my body, moving away from the screen and going outside. What about you, Ellen?
Sorry, I muted myself. I was writing a message. I'm dog sitting and he's got a cone and he's scratching and I had to mute myself. So I was writing a message to apologize for the background noise. So for me in the chat, I just put that I always try to remember the strong guidelines that we have in Canada, and I think it's in other countries, that have shown us 30 minutes of moderate cardiovascular exercise per week. So for me, that's been, and then my Fitbit helps me to remind me to try to maintain that.
Per week or per day?
No, it's per week. It's per week for disease prevention. And so I share that data often with my clients with disabilities or illness because it feels less overwhelming than the guidelines were 10 years ago when I did kinesiology training. When I did my kin training, I think 20 years ago, the guidelines were more like high intensity, an hour, X many times a week. And for someone that's had an injury or an illness or struggling with fatigue, like it's overwhelming. So that data has really inspired a lot of my clients. And then what I do for me, what helps, I do the same as you, the breaks on the hour, and my Fitbit is set up for this. If I didn't have the Fitbit, I don't think it would happen because I get too immersed in what I'm doing. So that's been my technique.
Okay,
Wonderful.
so guys, we are approaching the end of our session about health and wellness coaching. I would like to take a couple of minutes to do a little debrief and talk about some of the learning outcomes from this session. We would love to hear any feedback in the chat. Very insightful from Dr. Wafa. Yeah, Maha. Okay, great. Anyone else? What else did you take away?
Thank you, Maha. Thank you very much. Yes, takeaways. And please reach out. LinkedIn, email, please reach out and you'll get all of this data and ask more questions. We've just started. The tip of the iceberg.
I love the stats on how health and wellness can help the company's bottom line. Yes. Miriam says it's very comprehensive. I agree.
And Randy, I believe you have a practice, like a LinkedIn group for Saudi Arabia.
Yes.
And I wonder if that would be a good space if more questions are coming up.
Yes, definitely. You guys can, so that's one thing. We, on behalf, or me as the Vice President of the ICF chapter, would like to thank you for joining us. If you are not a part of a chapter, please join ICF Saudi Arabia. We need more people to be a part of the events, to bring in great speakers, to learn, to share. And so, yes, we will see you soon. The next session that we have is tomorrow, Thursday, the 19th at 6 p.m. KSA time with Mohammed Sharafuddin. He'll be talking about team and group coaching. We would love to see you all there. I would like to give a huge thanks and a round of applause for Coach Ellen Koshea and Coach Ellen. Thank you so much for learning today.
Well, thank you. It's with great gratitude that we thank you for having us. We love to create the ripple effect, as you noticed. We've got a lot of energy between us, and we will look very forward to hearing from you. And who knows, maybe welcoming you into our upskill training sessions sometime.
No problem. We'll be on for a little bit. If you have any last minute questions or comments, you are free to go.
Ellen is in British Columbia, Vancouver, just outside of Vancouver.
Oh, I see that question now, Diane.
Just came up from Diane.
Yeah.
Yeah, you guys did fantastic. Fantastic. Okay, we'll stop the recording now.
Wonderful.